Hello everyone, this is Dr. Muhammad Tayyab. Today we will discuss about anatomy of the female reproductive system, in which we will discuss about the external female genitalia, vagina, uterus, cervix, fallopian tube and ovaries. Let's discuss about the parts of female genitalia. We have external parts, we have internal parts. External parts also called vulva, which includes mons pubis, labia majora, labia minora, the vaginal vestibule, the clitoris, the greater vestibular gland. And internal parts also called internal reproductive organs, which includes the vagina, the uterus, the fallopian tubes and ovaries. Let me briefly introduce you by external parts. What is mons pubis? Mons pubis is a fatty tissue that just present anterior to the pubic bone, and it provides cushioning effect during sexual intercourse. What is labia majora? Labia majora is outer lips and labia minora is inner lips. They begin at the clitoris and end at the vagina. Now see what is the vaginal vestibule. It is the shallow depression between the labia minora in which external urethral orifice and vaginal orifice opens up. The clitoris is the player center of the female reproductive system, and it's a erectile tissue. Further, we'll see the embryological derivatives of female genital system. Labia majora derived from genital swelling, labia minora derived from genital fold, and clitoris derived from genital tubercle. There are few structures in male and female reproductive system. They have homology to each other. Labia majora have homology to scrotum, and labia minora to ventral aspect of penis, and clitoris have homology to glands of penis. Now we will discuss about the blood supply of vulva. Vulva get their blood supply via internal pudendal artery, and they got innervated by pudendal nerve that is derived from S2 to S4 segment, and the lymphatic drainage of the vulva is drained into inguinal lymph node. The clitoris drain into rosogenital lymph node in the groin region. Now we will discuss about internal genital organs. First of all, we will discuss about the vagina. Vagina developed from Mullerian duct. We have three walls of vagina. Interior walls is about 7.5 cm, posterior walls is about 9 cm, and the lateral walls of vagina form the fornix of the cervix. The epithelial lining of the vagina is stratified squamous epithelium. Vagina usually have acidic pH about 4.5 due to a bacteria called lactobacilli that reside inside the vagina. They produce lactic acid. That's why the vagina is acidic. Maximum acidic pH is during pregnancy and maximum basic pH during menstruation and at menopause. Now we'll discuss about the relations of vagina with other structures. Anteriorly, vagina have a urinary bladder and urethra. Posteriorly, there are three structures present: upper 1/3 of pouch of Douglas, middle 1/3 of ampulla of rectum, and lower perineal body. Laterally, vagina have transverse cervical ligament, which is also called McEnroe ligament. The epithelial lining of vagina is transitional epithelium. The vagina get their blood supply through three arteries. You can remember them as a DIM. Descending vaginal artery, internal pudendal artery, and middle pudendal artery. And vagina get their nerve supply through vaginal nerve. The upper 2/3 of vagina drain into deep pelvic nodes, and the lower 1/3 of vagina drain into inguinal and femoral lymph nodes. The functions of vagina is mainly three. It provides a passageway for blood and mucosal tissue from the uterus during a woman's monthly period, and it receives the penis during sexual intercourse. It also holds the sperm until they pass into the uterus, provide a passageway for childbirth. Now let's discuss about the uterus. And there are two parts of the uterus: body and cervix. The body epithelial lining is columnar epithelium. The position of the body is anteverted and antiflux, and it is pear shaped. The weight of the uterus vary in pregnant woman and in non-pregnant woman. In non-pregnant woman it is about 50 to 70 gram, and in pregnant woman it is 1000 gram. The length of the uterus is also vary during pregnancy and normal situations. In non-pregnant woman, the length of the uterus is about 6 to 7 centimeter, and in pregnant woman, the length of the uterus is 35 centimeter. The volume of the uterus in non-pregnant woman is about 10 ml, and the volume of the uterus in pregnant woman reaches up to 5000 ml. Blood supply of the uterus is through the uterine artery. Now we'll discuss about uterine cervix. It is cylindrical in shape and it has two types of epithelial lining. The columnar epithelium lining lines the endocervix and squamous epithelium lines the ectocervix. There is a transitional zone where columnar epithelium converts into squamous epithelium. The clinical point for transitional zone is that it is the most common site for cervical cancer. Blood supply of the uterine artery via the descending cervical artery, and it's get there is a nerve innervation from S2 to S4 segment, and it develops from Mullerian duct. The function of the uterus is that it is responsible for the process of implantation, gestation, menstruation, and labor. Now we'll talk about fallopian tube. It is also called uterine tube and oviduct. It is a tubular structure that carry egg from the ovary and transfer it to the uterus. The fallopian tube has three parts. First part is called isthmus. It is the closest part to the uterus. The second part is called ampulla. It is dilated part and it is the most common site for fertilization. The third part is infundibulum. It is further away from the uterus. The clinical point is about ampulla over here is that it is the most common site for ectopic pregnancy. The fallopian tube gets its blood supply through two vessels, two arteries. The medial two-thirds of the fallopian tube get their blood supply via uterine artery, and the lateral one-third fallopian tube get their blood supply from ovarian artery. The epithelial lining of the fallopian tube is ciliated columnar, and it get innervated from the T11, T12 and L1 segments. It is developed from Mullerian duct. The function of the fallopian tube, as I already mentioned, that it carry egg from the ovary and it transfer it to the uterus. Now we will discuss about the ovary. Female has two ovaries, and the epithelial lining of the ovary is cuboidal type epithelium and germinal type epithelium. The relation of the ovary to the lateral pelvic wall with the help of infundibulopelvic ligament, and ovary attached to the uterus with the help of ovarian ligament, and it attached to the posterior wall with the help of broad ligament which is called mesovarium. Ovary get their blood supply from ovarian artery and it is innervated by ovarian plexus. Ovary has many functions. It produces egg, and it produces hormone like estrogen and progesterone. During ovulation it produces egg that get fertilized later on in the fallopian tube and then delivered to the uterus. There it is get implanted. Thank you so much for watching my video. Hope you like it, and share it with your friends and subscribe my channel. For more update, stay tuned.